Welcome to a special episode of TrialSite News. Today on our show, we have a follow-up conversation with Patrick Girondi, the CEO of Errant Gene Therapeutics, who has been in a David versus Goliath legal battle for the past several years, which surrounds the claim that Memorial Sloan Kettering is withholding a groundbreaking product pivotal in a treatment of a rare disease. And so, here to facilitate this conversation surrounding this fight, TrialSite News founder Daniel O'Connor will be sitting down to discuss with Mr. Girondi about where we are now with the situation and where do we go from here. So, Daniel and Patrick, welcome to the show.
Thank you. Patrick, great. Thank you so much for joining our show and agreeing to share more about the current situation with your company, with the intellectual property, and we know is an important potential cell therapy treatment. Could you maybe just summarize for myself the status of your most recent case? We know that you settled your last case, and it would appear that your company was ready to start furthering the development, advancement of this cell therapy. But if you could maybe just take a couple minutes and give me an update.
Sure. So we settled our case in 2021, basically, the beginning of the year. And we're collaborating with Michelle Settlin, researcher and head of the Settlin Lab at Memorial Sloan Kettering. He had received with Cornell $15.7 million grant in 2014 to improve our product. And he put on an insulator on the product. He recently published 4 months ago the proof that lentiviral vectors without insulators are less safe. So we were very enthusiastic because with the $15.7 million from New York Stem Cell, he had made enough product to treat 4 patients. He had written the IND, and we were ready to go and either begin a new clinical trial or piggyback on the clinical trial in which we've already treated patients. The first patient treated in November of 2012. So everyone was very excited and ready to go, particularly because Bluebird Bio is pushing ahead further and further to trying to get into patients. Now, they had a partial approval in Europe, but then could not get Europeans to agree on $1.8 million per patient, and they pulled out of Europe. Their price in the United States is $2.1 million. Their product does not have an insulator on it. But on June 8th, 9th, there was a vote at the FDA, 13 pro, that they would like the product approved and 1 abstention. And they'll announce the approval or not on or around August 20th. Well, in the beginning of 2021, we were just pushing quickly ahead, collaborating with Dr. Michelle Settlin, Isabelle Riviere, and the wonderful people in the Settlin laboratory at Memorial Sloan Kettering. July, that all stopped. In July, we received an official communication from attorneys at Memorial Sloan Kettering that they wish that we no longer speak with the researchers. Someone would ask why they would do something like that. And the first thing that came to mind is that they must want to develop the product themselves for patients. Maybe that's the possibility. Instead, the medicine is sitting in the freezers at Memorial Sloan Kettering. They are not funding their own researcher to go forward with clinical trials. So someone would ask, well, if they're not funding and going forward with this medicine, which they were supposed to give to us, what are they doing? There seems to be only one answer. And that answer is they're doing everything in their power so that the Bluebird Bio product can be approved. Now, in Family Man, in the interviews that we had in the past, it was all revealed that is exactly what happened, that Third Rock Ventures, Bluebird Bio, and executives at our partner research institute had been in cahoots and basically destroyed our product, shelved it. We, after July of 2021, of course, were shocked and did some initial investigation, discovering that Bluebird Bio is using our patents, our product, on their product. And it wouldn't be so bad if Bluebird at least had an insulator. But after the article from Memorial Sloan Kettering's own researcher, in which it's basically assumed that if you do not have insulators on the lentiviral vector, they are less safe. And considering the fact that Bluebird Bio patients, sickle cell disease patients in particular, have had issues with leukemia and myelodysplastic syndrome. Thalassemic patients originally, back in 2009, had problems with clonal dominance. Then you would think that a wonderful institute that Memorial Sloan Kettering is would be galloping forward with a better product. That, by the way, using the price that our company would charge of $700,000 and then moving down, because gene therapy roughly costs about $300,000 to produce. You'd think that they would be galloping forward. Instead, now we are back in court trying to figure out why they are not giving us all of the, not returning all of the data to us, and why they are again blocking progress.
You know, this seems amazing to me as we, TrialSite News, chronicled your lawsuit and the outcome, a settlement, and the parties agreeing to move forward. Now, just so I understand correctly, and, you know, we have a investigational cell therapy, gene cell therapy that is currently just sitting there idle on the shelf in the lab. It was funded with what may be public monies, New York Stem Cell Foundation, I believe, again, you had mentioned $15.7 million is what I heard.
Yes.
To improve this particular vector and to put an insulator on the particular intellectual property. Now, that was done, and I'm assuming that foundation, you know, may have some ties to the public tax monies. Is that true, or is it a private foundation?
Well, no, of course it's true. First of all, Memorial Sloan Kettering is a not-for-profit. So even though they have $3.5 billion of income, and even though their CEO makes somewhere around $7 million a year, and much of that money that they're being paid with is taxpayer money, they are a not-for-profit. The New York Stem Cell, which doesn't exist any longer, was also a state, 100% state-funded entity. So, I mean, 20, 30, $40 million of taxpayer money over the years has gone into this project.
Okay, so, you know, with that in mind, the funding that came from New York Stem Cell Foundation, and Patrick, at some point we're going to go back up higher level to understand the therapeutic area a little bit more. But in this particular situation, for you to proceed and to get this important therapy to market at a lower price point, significantly lower price point, I'm hearing $700,000 versus $2.1 million. I mean, that's a staggering difference. Okay. If we look at the monies that were publicly originated that went into the insulator, was the mandate to was it more basic research, Patrick, or conversely, was it translational research? Get this product to market to those patients in need as quickly as possible.
Yes, I mean, in the New York Stem Cell, so the New York Stem Cell grant was won by Sloan Kettering and Cornell. And in 2017, they promised on their report to the New York Stem Cell that they would be in patients within 2 years. So the idea of the 15.7 million was to treat patients with a safer and a better product. And here we are, 2019 is 3 years ago. So here we are 3 years after they had said they would be in patients. Dr. Farid Boulad is the one, I believe, who was quoted saying that, a principal investigator, wonderful guy, and the head of pediatric bone marrow transplants at Memorial Sloan Kettering, claimed that they would be in patients within 2 years. And unfortunately, the funding of New York Stem Cell ran out, and they received no funding from Memorial Sloan Kettering. And it's a joke from time to time when you hear that they didn't receive funding, when, again, like I said, the net or the gross income of Memorial Sloan Kettering is around $3.5 billion a year. So the fact that they couldn't find $2 or $3 million to push this project forward seems very silly, especially when you consider that the researcher who invented this product is a celebrated researcher, probably one of the most celebrated gene therapy researchers in the world, Michel Sedlin. He's been on the front page of the New York Times 10 times for his work in cancer and other non-cancer diseases. And he has his own laboratory named after him at Memorial Sloan Kettering, that they won't heed his wishes, which is to save patients' lives.
So, okay, so if we take a step back for a second, the intent of that funding was translational, to get this product to market, as you had mentioned, in a couple of years. Now, after that development happened, Memorial Sloan Kettering also, I believe, filed or got an IND, which is an investigational new product application. The application we submit to the FDA to get green light to commence human trial. Okay, so the IND apparently is 90% complete for the insulator-based product. Is that correct?
Yes, that is exactly what we were told by Dr. Michel Sedlin, that it was 90% complete. This is because in the beginning of 2021, there was communication, everything was going great. And we realized from Dr. Michel Sedlin that the IND was 90% written, that the product was sitting in the freezers at Memorial Sloan Kettering, enough for 4 patients, and that the initial tests were that it was far safer than the Bluebird vector or any other lentiviral vector for thalassemia or sickle cell disease that doesn't have an insulator. So we were all very happy to go forward. And then in July of 2021, everything fell apart. If you ask me, the obvious question is why? And I tend to believe that when we settled our case with Bluebird Bio, Sloan Kettering, and Third Rock Ventures, that they assumed that we would take the money that was awarded and go home. And maybe I would buy a yacht or a new car or get a couple more girlfriends or something. I assume they didn't believe that we would do the same thing that we've been doing for 30 years, which is push forward. And in July of 21, they realized that we're making more plasmids with Nature Tech. We're going to use smaller plasmids this time, and that we're pushing forward. And all of a sudden, out of nowhere, the phoenix arises from the dust and is again going to give problems to Third Rock Ventures, Bluebird Bio, etc. And I'm not talking bad about Memorial Sloan Kettering. It's a wonderful institute with wonderful people. However, we know about the incestuous relationships that the former, excuse me, the former CEO of Memorial Sloan Kettering, Craig B. Thompson, who's no longer there, about 3 weeks ago he left, has and had, because Agios Pharma is his company, formed by him in 2007. He was sued for $1 billion from his employer of 11 years for setting up Agios Pharma, and they claimed that he had stolen property from the University of Pennsylvania, was where he was the head of research. And of course, you can read it, the New York Times newspapers that talked all about this situation. And he was in bed with Third Rock Ventures, who basically gave raised $111 million for Agios Pharma between 2007 and 2011. So you can just assume, unfortunately, or I assume, that when the evil then figured out that we weren't just going to walk away with the couple of dollars that we got and live the rest of our lives and not worry about patients any longer, but that we were getting back in there and fighting for patients again, they basically decided to sabotage the product one more time, or to block the project one more time. And again, I invite Memorial Sloan Kettering to explain it to me any other way.
Okay, so Patrick, I have a couple questions along those lines. We have to remember that the intention behind the financing, the intention for putting together an IND at 90% completion, those are evidence of very serious intention to commercialize the product, because the patients need them. So we're rational people here, and we're trying to get to a rational place so we can understand this situation better. Now, in your settlement, and obviously there's some things you cannot disclose. You have parameters, but given what you can publicly disclose, your settlement with MSK, did it allow for your company, San Rocco, to have a licensure access to that product? That's the first fundamental question. Do you have a right to that product?
Yes, we have a right to that product. Anyone, even if they don't read the settlement, can understand that, because they can go onto my website and see that we have that product. So we do have the product. And I think the most important line, and I can say this because I was told by my attorneys that I could, that the last line of the settlement agreement says that parties agreed on this settlement agreement, or this settlement commitment, this settlement contract, for in the best interest of patients. Well, in the best interest of patients, in the best interest of patients.
Okay.
Well,
Sorry to interrupt. That is an important data point we're going to get to. So now here's a fundamental question. That insulator that was added to the product, I'm assuming it was added to the product you had a license to. A, B, did that fundamentally transform the product such that it would not be that same licensure, it would break the license? Is that possibly true?
Yeah, no, I mean, I don't believe so. I think that would be a great thing if Memorial Sloan Kettering believed, hey, we put an insulator on it, it's no longer yours, so we're going to run like hell and cure patients. That would even be something that I could understand. I would say, well, I don't necessarily agree with them, because all they did was put an insulator on our product, which is like changing tires on a car. I mean, it's still the same car. However, that part I could live with, as long as they were going forward for patients. Instead, they're basically, I mean, we really don't even know their position, because they're being very vague about everything, but they basically are not returning the product with the insulator to us. It's sitting in the freezer. They won't give us the IND, which is 90% written according to their own researcher. So again, could they argue, will they argue tomorrow that we're not entitled to it because they put it? Maybe, but that's not their argument. And if it was their argument, then you would assume that they would be pushing it forward into patients, which they're not.
Well, okay. So, and maybe this might go a little too deep from a legal perspective, but did they file additional patents?
Yes, in 2020,
Okay.
they filed an additional patent, which was basically our product with a patent with an insulator on it. Now, I see you're ready to speak, but their own researcher, Michelle Settlin, who filed the patent, assumes that it's ours because the patent is based on TNS 9.3, which is our lentiviral vector.
Well, exactly. They're adding to an existing IP, which you have an interest in. So the fact, Patrick, and again, we're not going to provide a legal analysis here, but at a high level, it would appear that you still have access, legal licensure. And if you look at the settlement, the reason they induced you to settle was because it was in the interest of the patients. And if they would have looked at your track record, you got into this business out of commodities and other things that you did to find a treatment for your boy and for other kids like him. That's what drove you. That's what got our interest initially. Okay. And full disclosure, we try to at TrialSite try to get to the transparency behind medical research. That's what really people have a real interest in that. So this is a classical case where there may be self-interests that are highly irrational that are blocking a life-saving treatment. And we're going to get to that. So now we have the IP. Your company has a legal right to it. The settlement between the parties was clearly to the betterment of the patient. Are there any competitive forces here? Is it possible that your competitor, I believe, is Bluebird, and they're a private equity-backed biotech company, well known? Is it possible that there is some kind of competitive overlay here where, if you're delayed, San Rocco's delayed, Bluebird has time to monetize that market at that higher price point of $2.1 million per treatment, which, by the way, has ICER, digression real quickly, has ICER, ICER, they're a nonprofit organization that prices drugs. They look at the overall value, okay? Have they analyzed that $2.1 million price point?
Yes, ICER was affirmative. ICER maybe 3 months ago came out and said that the 2.1 million was a fair price based on the fact that sickle cell disease patients and thalassemia patients are costing 150. I don't remember their exact number, but they said over a lifetime it represented a big discount to what it is to treat one of the patients.
So 700,000 is an incredible discount that truly could transform families' lives, in nations where these conditions are more prominent. Now, if we look at the situation, it sounds irrational. Here you have a nonprofit, highly prestigious academic medical center, right? Tier 1. Their interest is in patients. I mean, these are great people that work at Memorial Sloan Kettering. There's no doubt about that. We write about
Agreed.
that all the time.
Agreed.
So this clearly, Memorial Sloan Kettering withholding this intellectual property from you. They're not developing it. They decided they're not going to develop it. They don't have some arrangement with Bluebird like, there could have been in the past. There's no formal relationships. This is a highly irrational situation. Here you have a company that's willing to invest to advance this product to the market to help people in need, the patient. So could it be that literally this comes down to ego, and there are a few individuals that are in place that simply just don't want you to be the person to advance? That's highly irrational, and it violates public policy, every kind of notion of, sort of patient centricity that we believe in. Because from what it sounds like, either there's some kind of ties to Bluebird. Bluebird needs some time to market this product. And if you're out there, if San Rocco's out there developing, and articles get out there that you're getting closer advancing this product, and it has this insulator, Bluebird's product does not have the insulator. Can you talk a little bit about that? The difference, what's the risk factor here of stopping this product, not allowing this product to develop? Meanwhile, allowing the product with the insulator out in the market. Is there a risk there, Patrick?
I mean, I hope not, of course, but scientific research done by Memorial Sloan Kettering itself claims that there's a big risk in using the lentiviral vectors without an insulator.
What is, if you could briefly describe it at a high level, not too deep into the science, what does an insulator do to reduce the risk?
An insulator isolates the vector that's inserted so that it doesn't trigger other genes around it.
Got it.
So if it lands next to an oncogene, for example, and it triggers it, it could create cancer-like symptoms, problems, etc. So the insulator protects patients from this happening.
Got it. Got it. Okay, that's very helpful. So, we're in a situation where you're back in court because seemingly MSK is acting in a way that we can't fathom them to act. It's shocking. Now, could it be, if it is in fact now I know that as far as Bluebird, the Memorial Sloan Kettering has a new leadership. I believe they have a new CEO or director.
Selwyn Vickers, Dr. Selwyn Vickers.
Okay. And I'm assuming he doesn't have ties to some of these companies in private equity. With Family Man,
not that we have seen. We really applaud his being chosen, because he really doesn't seem, he's from Alabama. I think he was the vice dean, but he really doesn't have. We only found one company, a small, tiny company that he had ties to. So,
in the past, when the previous lawsuit that you had with that organization, there were some ties between the different entities, relationships, not necessarily overt and proven, but we definitely knew that.
Well, they were proven.
They were proven. Okay, so
they were proven, and you take a guy like Nick Leshley, who was a CEO for Bluebird for 10 years. He made over $100 million selling stock in Bluebird over the years, and all of the options that he got, etc. You take Craig B. Thompson, who was making between $6.5 and $7 million for 11 years at Memorial Sloan Kettering, or 12 years at Memorial Sloan Kettering, plus what he got out of Agios Pharma, which was funded by Bluebird, by Third Rock Ventures, which bought Bluebird Bio, of which Nick Leshley was a partner at Third Rock Ventures. Nick Leshley was the chief business officer or development officer at Agios Pharma in 2009, 2010. So there's really no doubt that they're connected as far as you could be connected, and that between Third Rock Ventures, Bluebird Bio, and Mr. Thompson, that they've generated well over $500 million because of their incestuous relations.
Well, if I look at Bluebird today, and this is a little bit of a side note, but relevant, Bluebird today is predominantly owned by just a handful of institutions. So State Street, I believe, has almost 20%, and they're a major institutional investor. Wellington Management, Vanguard, BlackRock,
I mean, the big guys got off with all the cake. You got to remember that Bluebird traded over $230 a share in 2018, 17. Today it's trading at whatever, $4 or $4.20 or something.
438.
438. So, it had a market cap at one time of 12 billion. I think the market cap now is, I don't know, 350 million or something like that. So there is some speculation going on by these companies, and they're hoping that, they can somehow throw a Hail Mary pass. And, for patients, I hope that they have a wonderful product and that it gets approved if it is the best product out there. I don't think that it is, but I mean, it fell from the heavens to hell. And, TrialSite News, actually, you guys, I think you did the first story in 2018, and in 2018, they had a $12 billion market cap.
Yes, it significantly changed. And when we reported on some of these things, Patrick.
And you got to remember, they spun off a company called 270 Bio. So if you go in and look at the Bluebird data right now, it's going to all be changed. But the fact of the matter is that they traded at a $12 billion market cap in 2018.
So
270 Bio, you'd have to go back and put 270 Bio together with Bluebird today to come up where they were at one time.
so
Because
on that,
Leslie is now the CEO, and 10 out of 12, I think, of the key players at 270 Bio are Bluebird Bio people, and they spun it off to protect some assets, etc. I think they took like 600 million and put it into that
Patrick,
that company.
we did it, and this is a digression but relevant. We did a story recently of a group of brilliant scientists. Okay, I won't say which academic institution on the East Coast they're from, but brilliant. They came together and they set up a private equity group, or they spun out a private equity group out of another group. And within a period of 2 years, Patrick, or maybe 3 years, they have funded dozens and dozens and dozens of companies, and actually have had 5 liquidity events via IPO. Now, we did a study of those. Everybody on the inside did very well. Okay. The minute they go public, every one of those stocks is on the basement floor. I mean, everybody, Mr. and Mrs. Jones from Iowa bought those stocks, and they're deep into
a lot of them are pyramid schemes, and
you got it. And so, Bluebird's in trouble. They're operating at a loss of over $500 million. Okay. We don't make claims here that we can't back up, but I will put out an idea that this company needs your company out of the market, period. Now, if there's any ties, if your lawsuit finds any ties to that company through discovery, they're in deep trouble, because the goal is to have a dynamic, thriving market for medicines that help patients get better. Ideally, competition is really good because it lowers the price. You have a license, you've invested heavily, you've been through lawsuits, you have the rights to develop that product. They're allowing that product to idly sit, waste away in a freezer somewhere. They're not working, they don't have a unit that's commercializing it. And they do have the company that has the license that wants to develop it, commercialize it. So the 90%, the IND was not 90% completed. That shows you they were ready, but then something happened. So it's quite unfortunate, Patrick. I mean, this, you have a remarkable story. TrialSite truly appreciated your background, how you were raised, how you lifted yourself out, how you did well in business, and then the arts and everything you're doing, your book. We're really impressed, and we're big fans. And the mission of helping get patients access to advanced therapies is our mission. So it sounds like it's one of two things: either Memorial Sloan Kettering just has some scar tissue from the lawsuit, and they just can't get over the emotions of having to, do what they need to do to live up to their obligations. All right, that's one. Or two, there's some kind of, financial understanding between Bluebird and Memorial Sloan Kettering up at higher levels. I don't know, but we do know Bluebird's in trouble. They're operating at a huge loss. They're at historically low share price, and they don't even have a superior product. Listening to what you're saying, the insulator really makes a big difference. So I'm perplexed. I'm at a loss of words. I put forward to you, what do you think about my two ideas in terms of what's behind this?
Yeah, I of course don't sleep sometimes at night trying to figure it all out, and I don't know that I'll ever be able to figure it out. But there's no doubt about it that, according to Memorial Sloan Kettering themselves, we have a safer product, better for patients. The product has already been produced. It's sitting in the freezers. And we settled the settlement, we settled the case for the best interest of patients. So you hit on something where you're talking about egos, et cetera. And I do think that one problem that remains is that Sloan Kettering is using the same attorneys post litigation that they use during litigation. Now, we know that during any litigation, feathers can get ruffled, et cetera. So after litigation was done, with the interest of starting a new pathway with Memorial Sloan Kettering, I got rid of my attorneys. Now, a couple of them are still affiliated with the company, but I decided from now on, I'm going to have new attorneys talk with Memorial Sloan Kettering, because I don't want any of the bad feelings or any of the bad blood that may or may not have existed during the litigation follow through. Unfortunately, Memorial Sloan Kettering is using the same attorneys that they used during the litigation. And these attorneys obviously dug their heels in during the litigation. Assaults, verbal assaults were thrown like, nothing. Insults, you name it. And unfortunately, they're using these same people to deal with us today, even though I suggested that we start anew.
Well, attorneys have fiduciary obligations to do the right thing and not to, help a prominent academic medical center subvert its mission, which is helping patients. So, that's horribly off and wrong if that's the case. Now, let's for a quick minute talk about the patients. If we look at the gene therapy that you are on the verge of being able to commercialize, should you be able to move forward, what does it look like out there in terms of worldwide versus maybe a Mediterranean country like Italy or to the United States? These conditions, about how many patients are worldwide suffering with this condition? Is it considered a rare disease? Could you just high level few stats on that?
Yeah, so thalassemia and sickle cell disease are the number 1 and 2 genetic hemoglobin diseases in the world. So there's 1 million thalassemia patients and 800,000 sickle cell disease patients in the world. In the United States, there's about 100,000 sickle cell disease patients, about 2,500 thalassemic patients. Now, in the United States, any number under 200,000 of patients is an orphan disease or a rare disease.
Yes.
So these are huge numbers.
So now let's talk about these patients. Is it true with sickle cell, there tends to be a genetic predisposition? For example, African Americans may be afflicted with that more. There's certain genetic predispositions. I know Mediterranean heritage. This is an important point. Is there a socioeconomic factor to these kids? Are a majority of these kids coming from lower socioeconomic backgrounds?
Well, 70% of thalassemic and sickle cell disease patients in the United States are on aid, are on government subsidy for their medical care, 70%.
So that's going to be either probably Medicaid. Okay, so I want you to think about this, Patrick. We're talking about already a vulnerable set of patients, just from a health perspective. Then we're talking the social determinants of health. We're talking about these children, young adults, come from disadvantaged backgrounds. There isn't the economic means. I want you to think about this. The way this is unfolding, a product that is seemingly less safe and significantly more expensive is going to be offered. The product that seemingly is potentially more safe, significantly more safe because of the insulator, and is deeply discounted, because of the ethics and the morals and the principles of the company developing the investigational product, is being blocked because a nonprofit, well-meaning institution isn't talking to you to move forward. And these kids are suffering. This is a tragedy. I mean, this is really, really not good. So I would say that, we should process this more. We need to look into, how we can, use information and education, to help, the right parties understand the importance of this mission.
Yeah, I mean, I would welcome TrialSite News to, give a little call to the public relations people at Memorial Sloan Kettering or wherever it is you might want to call and call Michelle Sedlin. Maybe you want to call the new CEO, Dr. Selwyn Vickers, and ask them, where their position is. I mean, how is it that you receive almost $16 million from a not-for-profit New York stem cell organization, and here you are 3 years late going into clinical trials and claim to have no funding to do so with a safer product? I mean, it's all kind of insane. I mean, I don't know what else to say about it. It's very sad.
Patrick, and this better than I do, the healthcare system, isn't always necessarily driven by the patient nor what the right decision should be. It's often driven by money and by economic interests. But I think we're all part of a movement to help evolve that unfortunate ethos. And so that's why we started TrialSite. We wanted to bring transparency to medical research, because often it's opaque, it's cloudy, it's not clear, and that's for a reason, right? Because knowledge is power. Patrick, we'll wrap this up. We will look into this. We're fans of yours. Again, we believe you've done some great things, and we're grateful for people like you, for a number of reasons. And we encourage you to keep doing what you do. And with these patients in mind, I believe you will be successful, because you're the type of person that doesn't stop.
Yeah, thank you. And anyone who has any interest to understand the case better, of course, the book Flight of the Rondone, which was just published by Skyhorse on August 1st, it came out as well. The audio book is out. So I, invite anyone that's watching this video to get the book and learn a lot about our healthcare industry.
Flight of the Rondone. I mean, I can't emphasize enough that it's going to be a good read. It's important. It's from somebody that has experienced this biotech health industry from different vantage points. So I think it's a very powerful read. Patrick, we want to thank you very much for taking the time. And again, we'll definitely keep our reporters looking into this case, and we may try to reach out to Memorial Sloan Kettering. Thank you very much.
Yeah, thank you very much.
You got it.
All right, thanks, gentlemen. Patrick, Daniel, for taking the time out of your busy schedules to talk about this issue. And Patrick, for those who want to follow your story, I know you mentioned the book. Is there a particular website or link you'd like to?
So Flight of the Rondone, Rondone, of course, my name is Patrick Girondi, but it was a #1 bestseller on Wall Street Journal in the first week of July. It was #1 bestseller in Amazon for 2 or 3 different subtitles, like Professionals in Medicine, et cetera, et cetera. It's on Amazon. You can get it at Barnes & Noble, Walmart, Target, wherever.
Perfect. Yeah, and if we can, we'll get a link from you, and we'll link it in the description.
Thank you very much.
And then final word to our audience, just a heads up, with widespread censorship, there's a quest for objective, independent, and unbiased information about health-related research becomes ever more difficult to obtain. Yet, what is more important than transparency, accessibility, and veracity in the science behind our medicines, diagnostics, and devices? Well, TrialSite News has a social network that is now here. and is designed to encourage dynamic channels for thoughtful, meaningful, and candid conversations concerning the most pivotal medical research matters. You can start or join groups in our health-related research topics of interest that interest you. And all of this you can find at TrialSiteNews.com. And you'll never have to worry about censorship because dialogue, debate, and even dissent over various hypotheses or theories remain key to ongoing scientific advancement in medicine. So come join us and help make censorship-free conversation make a comeback. And that, my friends, will bring our episode to a close. Once more, as always, thank you so much for joining us on the show today. From TrialSite News, I am Adrian, and we will see you all next time.